If we're going to take an x-ray, Bo would lay down, we'd take our x-rays, and with the way digital works is the x-rays are actually captured in here on a computer. So there's a computer image generated that the electrons are actually soaked into this special thing. We put it in this machine here. Those x-ray, that film is basically developed, and it comes right up on the computer screen.
Wow.
So basically every dog, even though we're using digital, we need to measure the thickness of the dog to determine, and that'll determine how many x-rays need to be produced to shoot through a puppy dog this size. So Ann's checking the thickness and the height of Bo's chest. And then on this machine, you can plug in that you're taking a chest x-ray. So she consults this chart, and it'll tell her what to set the machine on. So Ann's going to try to get this x-ray and time it so Bo's taking a breath. Now that would be considered Bo's laying on his left side, so that'd be a left lateral. And very quickly here, or I'm sorry, he's laying on his right side, so that would be considered a right lateral.
Not fast. So that was pretty fast for that to come up. Yeah. And now that can be sent to a specialty place or anybody that wants to get another read on it. Yep. Unbelievable.
Yep. So what we can do is from this machine, and we'll then send it to a couple other computers, one of them being an iPad, which we can take and show the owners. So what we're seeing here, there's a lot of stuff on this x-ray. We've got two of his humeruses, 2 shoulder joints, the whole chest, bunch of ribs, sternum, vertebral bodies. The diaphragm has 2 legs. You can kind of see one there, so the diaphragm's intact. Then of course, we have the heart. And the way an x-ray works is the x-rays are going through the patient like this. Let's say if there was a mass behind the heart, okay, let's say he's laying on his right side, so we're seeing mostly the upper lung, the left lungs. We're really not seeing a whole lot of the right lung because they're not full of air, the left lung, since he was laying on his right side. So x-rays would be absorbed by the heart muscle, but if there's, say, a lesion behind the heart on the right heart, it may not show up. So that's why we would do a right and a left, and then also what's called a ventral dorsal or dorsal ventral view to give us the best interpretation. But we can see this big black tube right there that comes down, that's the windpipe, trachea. This is the aorta coming back. You see this white thing coming back. Right here, this little white thing coming in, that is the caudal vena cava. That's a big vein that carries the blood back to the heart. We actually we see these little like white, looks like tree trunks. Those are all bronchi, and they'll end in, they're the part of the air exchange, the bronchial tree. So then the black is all lung. And then they're up in here, which you can't see very well, would also be, you can't really make out the esophagus, but the tube that carries the food from the mouth to the stomach, it would be in this area as well, right next to the windpipe. And then there's also a couple other things in there, the cranial vena cava, which you can kind of make out a little bit. But when we're doing a thoracic study, it's not just one view.
Yeah,
down, both sides.
I'm just amazed at the speed.
It is.
How quickly. And I'm also amazed at your ability to send it to a specialist or a radiologist to get additional information. Yeah, that's just great.
And that happens quite frequently because, I mean, there's sometimes you'll see something that's obvious. I mean, obvious right-sided heart enlargement. Whatever, but there's a lot of times you got to know, is this normal or abnormal? And you say, well, that's abnormal, okay, but what exactly is going on? So we'll get a second opinion very quickly, usually within a couple hours. What we did here was we did a double contrast. So we emptied the bladder, put a catheter in the puppy dog, emptied the bladder, put the contrast material in, kind of rolled the dog from side to side, then filled the bladder with air. And it's really neat is that you can see how obvious these growths are, these what they call filling defects. They show up very well. And if I showed you an x-ray of this dog without the contrast media, you wouldn't even notice it. And so that was kind of a way that we can use x-rays in just a few more specific studies. And that could be done in the stomach as well, called an upper GI, and that barium will show up in the stomach, and you can follow it through the small intestine. A lot of times we do that if we think a dog ate something, but we can't see it. So